In today's video, we'll break down my 3-step process to help you fix your low back pain that's not just stretching or doing glute bridges. First, we need to understand why we're having back pain in the first place. There might be a lot of reasons why you're experiencing low back pain, but at the end of the day, pain is perceived, and some people may perceive it more than others. And so understanding that, although we're taking a more biomechanics perspective on this today, there's gonna be a lot more things you can do that are gonna help your perception of pain. That could be working on getting more sleep, it could be managing your stress better, but that's for a different video. We might be experiencing low back pain from a biomechanics perspective because we're lacking mobility in certain ranges of motion. And typically in my clients, this is gonna be a lack of internal and external rotation of your hips. So if we lack the mobility but still want to complete the movement, we're normally gonna compensate to get to that end result. This can mean shifting and tilting of the pelvis forward, backwards, or side to side to create more range of motion for you to be able to complete that movement. The shifting and tilting of the pelvis normally leads to more compensations of the low back since we don't have the adequate range of motion at our hips, which can make it more challenging to maintain a stable spine during your exercise. Essentially, we want to maintain the neutral position of our pelvis and of our spine during movements so there's less compensation and we have ability to move into different ranges of motion. We're not just stuck in one of those tilts of the pelvis. The first step is testing your range of motion. To test your hip internal rotation, start by lying down on the floor and flex one leg up to a 90-90 position. From there, you're going to make sure the knee stays in line with the hips the entire time. Rotate your upper thigh to the outside with your foot leading. The test is over if you feel the muscle cramping up, if your knees want to cave in or cave out, or if you have to force that range of motion to get further. The normal active range of motion should be around 35 degrees. To test our hip external rotation, you're just going to focus on going the opposite direction. The same rules apply to this assessment as well. You shouldn't feel any cramping, you shouldn't have to force the range of motion, and you shouldn't be deviating too far away from that midline. The normal active range of motion for hip external rotation should be somewhere around 45-ish degrees. If you're lacking internal rotation measurements, this likely means that you have a lot of compression and a lot of concentric activity of the deep external rotator muscles of your booty. This is going to limit the ability to internally rotate your pelvis along with your femurs. This will really limit movements like a squat because as soon as you get your hips flexed around 60-ish degrees, you will require more internal rotation relatively compared to when we start the motion. If you're lacking external rotation, this normally means you have an anterior orientation of your pelvis. This is a compensation your body does to help find more internal rotation. This is also going to limit your movements like a squat because instead of shifting up and down like you should during a squat, you'll more than likely start shifting in a diagonal fashion instead of straight up and down. You'll be bumping your butt back, having a more hinged like squat, and this can cause a lot more wear and tear on the SI joint in your low back. So instead of your hips moving because they're all locked up, your low back is now going to start to move to help you still complete the lift. So Tyler, we test the range of motion, we're limited. How do we actually improve it? Number 2 is focusing on positional drills. Coming from my background in physical therapy, I've seen a lot of different methods and treatments to help people with low back pain, but this is the method that stuck the best for me. And here's why. We put our body in the best position possible to recruit the muscles we need to see our improvements in posture and our mobility. And we also pair these positional drills with deep breathing. With most people having a lot of compression on the front and back side of their body, this allows us to work on getting the full expansion and compression of our rib cage and pelvis, which is essential because our muscles lie on top of our rib cage and our pelvis. This will also help make long-term changes because if your body is in a stressed out state with a lot of painful stretching, you're not going to be likely to make long-term changes because your body is still stressed out. Versus if your body is de-stressed, you're gonna have a lot better chance of making long-term changes because your body will actually be able to adapt to that. So a drill I use all the time to help improve my clients' internal rotation is actually side lying breathing with a foam roller. You'll start this exercise by lying down on your side with your hips bent up to about 90-ish degrees. This is gonna help bias you into a more internally rotated position of your pelvis. You're also gonna place a foam roller on the side that you're lying on to help get more side-to-side compression, which will help improve your ability to expand on the front and back side of your pelvis and your rib cage. And then simply just focus on deep breathing here, focusing on getting expansion of the front and back side of your body. You'll exhale all of the air out of your lungs and then hold that position for about 2 to 5 seconds. You should feel your obliques or your side abs kind of turn on here. And then you're going to work on inhaling through the nose with a tongue pressed to the roof of your mouth for as long but as chill as you can. This should also be silent. You shouldn't hear yourself breathe in very forcefully because that will recruit more of the anterior neck muscles. You'll repeat this cycle for 2 sets of 5 breaths on each side of the body. A drill that will help improve your external rotation is gonna be a hook lying hamstring bridge. You'll want to have your hips less flexed to about 60-ish degrees or so. You'll slightly tuck your hips underneath you to flatten your low back on the floor while gently pressing your feet down into the floor. You want to make sure you're also pressing through the inside of your foot more than the outside, but making sure you still have full foot contact. You're still going to work on the same steps steps here as before, but now you're just going to focus on more expansion of the back side of your body. Once you do these exercises, a good way to make sure that you actually saw benefits from this is retesting your range of motion afterwards. If you see your range of motion improve from last time, it'll show you that you did reduce some compression and tension you had in your pelvis. To now own these new ranges of motion, we go into step number 3, which we reinforce the range of motion we just got with exercises. An important concept I want you to take away from this step is the stack. The stack is essentially the relationship between your pelvis and your rib cage on top of one another. Maintaining the stack will help make sure you have a neutral position of your pelvis and of your spine that will allow you to have the most range of motion availability during movements. A good way to think about the stack is think about your hips as a bowl of water. If you spill the water out forward, that's more representative of an anterior pelvic tilt. If the water tips back to you, that's normally indicative of a more posterior pelvic tilt. The main goal of the stack is to keep the water from spilling out the front and back side. You want to pair the stack with the movements that you're doing during exercise to help maintain your best chance of spinal stability. One of my favorite ways to reinforce the stack is by doing a split squat or a lunge, because you'll need more internal and external rotation of your hips to complete that movement. During that lunge, you want to think about maintaining that neutral pelvis and keeping that bowl of water from spilling and making it look like you wet yourself. Feel free to reduce the range of motion or add support as needed. If you got value out of this, make sure to hit subscribe because there's more content on the way.